So, friends, we have seen how this corona has affected the whole world. But especially if we seek how the corona is affecting the half of the world, we have got Dr. Veena Acharya with us, who is a senior consultant in Rajasthan Hospital, who has worked as a superintendent of Mahila Chikitsalayah, who has worked on many important posts of National Association of Reproductive and Child Health of India as a president, as well as now she is the dean of the ICMCH. So Dr. Veena Acharya will tell us how it is affected by the pregnancy and how pregnancy is affected by this. Please.
Good evening to all. Thank you so much for giving me the opportunity to share my knowledge. This is the time that when we should be extra precautions take for the pregnant woman in this COVID pandemic, because the pregnancy itself is the quite more liable to have these infections, because pregnancy is an immunosuppressive conditions, and during this time pregnant women are more susceptible to this infection. So we should take extra precaution for the pregnant women. So first and foremost, it is very important to take the precaution for the pregnant women in this pandemic era. We should take extra precaution that all women who is the pregnant should be kept in the home, isolated, with well ventilated, and she should be if she's working, she should be take the work from the home. She should have limited her visiting outside, and the visitors in the house should also be limited, because the she's if there is a clinical history showing anybody in the family is having the corona, she should take quarantine, because we should take all the precaution for the pregnant women. And if you find that pregnant woman, and regarding her antenatal visit, should be also limited from the 8 to only 3 or 4 visit. So the pregnancy visit during the doctor should be already prior appointment should be there, and the obstetrician should be, she should know which obstetrician she should go. So the prior appointments of visiting should be first trimester, only in the first trimester. Before the 18 weeks she should have the first visit, and after that 2 visit at 32 weeks and after 36. So the limited about the antenatal. If she is having any problem during the pregnancy, she should consult her obstetrician. And suppose during the pregnancy she developed little bit symptom regarding the fever, cough, malaria, or pain, or anything, she should immediately consult the physicians regarding this pandemic. And if she found that there is any sign and symptom of the corona, the physician should look after her. So it is very important, because the pregnancy we look after the two life at a time, the maternal life and the fetal life. And it is very important that during this time, the pregnant woman should know who is her physician and who is her obstetrician. It should be priorly fixed, and there should be no problem at the time of delivery. So the physician should take all the care of the pregnant woman if she develops the any symptom and sign about the COVID-19. And if there is any sign and symptoms, we should be take extra precautions for the women or the women. And she should be, if have the only mild symptom, she should be quarantined at the home. That is the best for her. And all the precautions regarding her, the medicine, diet, exercise should be properly tell her about this. Regarding the intrapartum during the time of the delivery, that is a very important time. So she should already prior fix who is her obstetrician. And this in COVID pandemic, it is very important that she should deliver in this some either the government hospital or some big hospital where the ICU facilities should be there. Because it's pregnancy, there is, if she's having the COVID-19 or any problems, she's more liable to have the hypoxia or the respiratory problems. So at the last moment, if she develop any problem, then there will be big problems for her. So it is very important that she should be registered in the big hospital. And during that time, if there is a, so what is the time or what is the effect of the pregnancy on the COVID or COVID have the pregnancy? There is no very limited data that the corona is transmitted from the vertical transmission, but still there is a limited data that showing that there is the minimum chances of the transmission of the this. And there is a, but if she develop the severe corona problems or some hypoxia or any problem, there are more chances of the preterm baby, intrauterine death, and the growth retardation. So Whether she should go for the cesarean section or she should go for the normal delivery, it is totally individualized. And we should be decided at the time of the delivery whether she will go for the cesarean or this. Because the chances of the delivery normal take longer times. So if she develop hypoxia or any respiratory problem, we should try that she should develop or she baby should be delivered urgently by cesarean section so we can manage the woman because the maternal life is also very important. And regarding the preterm baby, because if she had developed the fever, high grade temperature or anything, there is the cause of the preterm baby intrauterine death, and that is the problem. Another big question is regarding the baby feeding or the after the delivery, whether she can feed the baby. There is no contraindication that that virus is going to the breast milk or anything. So she can easily breastfeed the baby, but she should take all the precautions regarding this close contact. And she should always wear the mask when she's holding the baby or touching the baby. She should wash her hand. Cleaning is a very important for the mother when she's holding the baby, and but she can breastfeed the baby. And regarding the lot many questions regarding the vaccination during the pregnancy, it is still very limited study in our country that the vaccination should in pregnancy. Some say if the vaccination is given during the pregnancy, that will save the mother and the baby. But in our ICMR, and still there is no recommendation regarding the vaccination during the pregnancy. So there are so many, but what I want to give, that's my take home says that the pregnant women, if she's suffering from the corona, we should take extra precaution. And because she may require the intensive care unit, and she should register prior and take all the precaution. It is the duty of the family members, society, and all the doctors that we are dealing with the two life at the same time. Thank you so much.
Well, thank you very much. Thanks a lot for the information.